Hello everyone, this is Dr. Abha Singh. Welcome back to our channel. In this video, we will walk you through the timeline of dental fluorosis.
Let's begin.
The story of fluoride started in Colorado, USA in year 1901 when Dr. Frederick Mackay noticed that most of the patients have a particular brown stains on his tooth, and he named them as Colorado stains. Later, as he researched more about it, in 1908 he decided to call them as mottled enamel or mottled teeth. In 1912 he came across an article of Dr. J.M. Eager written in 1902 where he mentioned about same findings in Italian residents of Naples and called them as dentaleducation. In 1916, Dr. Mackay and Dr. G.V. Black came together and examined 6,873 individuals in 26 communities in USA. They found that unknown causative factor in domestic water could be responsible for this. Now, this later was confirmed by work of Dr. O.E. Martin. Dr. O.E. Martin observed children born before change in water supply were normal and children born after change in water supply from shallow well to deep well in year 1898 had stained tooth. Similar results were reported in bauxite children who were born prior to 1909. They did not show any stain, but children born after 1909 have showed stains. The reason was same. The water source was shifted from shallow well to deep well. To confirm this theory, Dr. Mackay also performed same experiment in Oakley. There, they shifted the water supply from deep well to shallow well. And they noticed that after 7.5 years, around 24 children born in Oakley following the change of water supply did not had any brown stains. Now, only question remained was, what is that element? In 1931, Churchill H.W., a chief chemist of an aluminum company, analyzed water of bauxite and found fluoride level of water was 13.7 ppm. Churchill asked Mackay to send samples of water of his community and other endemic area showing mottled enamel. So in 1931, Mackay was rewarded to found the relationship between presence of fluoride in domestic water and mottled teeth. The most evidence of direct proof was further established by in-depth study popularly known as shoe leather survey by T.H. Dean. Dean continued Mackay's work and found out the geographical distribution of mottled enamel in USA by US Public Health Services in 1931. Dean established that concentration of fluoride in water is directly correlated with severity of fluorosed enamel. The study was conducted in 22 cities of 10 states on 5,824 white children. He also found that in area where fluoride was more than 3 ppm, more mottling was widespread. In area with 2.5 to 3 ppm, the teeth had dull chalky appearance, and in area with 1 ppm fluoride concentration, no mottling of any aesthetic significance was noticed. But in area with fluoride level more than 4 ppm, discrete pitting was noticed. Based on this, he gave Dean's classification in 1934. In 1936, he presented evidence that fluoride up to 1 ppm in water is not hazardous. If it was not hazardous, was it beneficial for us? Now, that was one of the questions raised in 1916. Mackay had this doubt that there were so many children who had dental fluorosis, but they didn't have dental caries. Now, the proportion of children with dental caries was significantly high in the area where fluoride was not there in the water, but there was no proof for this correlation. But soon in 1933, Amersworth reported it for the first time that there is a correlation between fluoride concentration and dental caries. Even Dean was working on that. In his study, he observed that children taking domestic water containing fluoride concentration of 0.6 to 1.5 ppm had only 4 to 5% of dental caries, and on other hand, children with 1.7 to 2.5 ppm had 22% of dental caries. Now, the next step was to confirm this hypothesis. A survey was performed that was published in 1939. For this study, 4 cities were selected. 2 had a fluoride concentration of 1.8 and 1.7 ppm. They were Glasgow and Monmouth. The other 2 had a fluoride concentration of 0.2 ppm. They were Macomb and Quincy. There, 885 children were selected of age 12 to 14. They were examined and results showed that dental caries experienced in low fluoride area were more in comparison to high fluoride area. After this study, they conducted an extensive epidemiological study which was conducted on 7,257 white children aged between 12 to 14. It was conducted in 21 cities of 4 states of USA who used local water since birth and found similar results and confirmed that fluorosis and dental caries are correlated. This ends with the history of fluoride.
If you want to know more, please tell us in comment section.
Thank you for watching this video. Keep motivating us and keep subscribing our channel.